Now we're going to talk about a quad cough. This is assisting a patient that's quadriplegic that does not have a good forceful exhalation to help them cough and mobilize secretions. So what we're going to do will be much like what's taught in CPR, which is a abdominal thrust. But you're going to coordinate that with whatever forceful exhalation the patient can generate. So you start out with the patient in a flat bed. You may use a slightly Trendelenburg, but I prefer a flat. Have the patient inhale 2 to 3 times as deeply as possible, and then on the third one, together you forcefully help the patient exhale. It'll be similar to this. Okay, take a deep breath in, let it out. Deep breath in, let it out. And on this one, breath in and cough. And you're going to push up as the patient coughs. We'll show that again. Deep breath in, let it out. Deep breath in, let it out. And on this one, we're going to cough in and out. And you're going to push without breaking ribs naturally to help the patient generate a much higher and forceful expiration.